So our first position that we can use is called the semi-sitting lounge. So we have our wonderful coworker, manager, Lorna. How tall are you again?
5'5".
5'5". So normally we would think to use the 60 centimeter ball. So we will try fitting the 60 centimeter ball. So for the semi-sitting lounge, we want Lorna to lift up one foot. Thank you. Okay, the bottom leg is going to be perpendicular facing the wall. The top leg, the peanut ball is going to be in between, and the knee should be facing the top, the ceiling, straight. Now, Lorna, is this a comfortable position for you? No. Yeah. So I can see it. It looks like there's going to be a little tension in the hip area, and her ankles are not really opening up as well as we would like. So let me try a different size ball. I'm going to try the 50 centimeter ball now. Okay. All right. Now making sure to cover our peanut balls, we have our 50 centimeter ball. All right, Lorna, let's try this one. Oh, wow, this looks a lot better. How do you feel?
Much better.
Okay, so for this position, we want the peanut ball. Sorry, I'm positioning you. We want the peanut ball like this, where her bottom leg is facing the side of the walls, and the top leg, her knee, is facing the ceiling. And then we see that it helps open up the top of the hips, which is opening up the inlet. So we allow for fetal descent through the inlet pelvis. Then, and you're comfortable?
Yes.
You feel good?
Yes.
Always want to check in with the patient because we want her to feel comfortable. If she is tense, it can slow down the process of fetal descent. So we always want to provide comfort. Then we are going to try another position, one of my favorite positions. So this position is called the lotus position. So Lorna, for this position, I am going to have you sit up in the bed. Thank you. So you're going to sit all the way up. And this position is very good for patients who have just received an epidural and who are stable with their blood pressures. So once they're stable and we are no longer monitoring for stable blood pressures, we can start within about 20 to 30 minutes, we can start utilizing the peanut ball, especially once the patient is stable. So this position is called the lotus position. The patient is going to sit all the way up in the bed, sit up as high as possible. We're going to get a peanut ball for this one. I'm going to start again with the 60 centimeter ball. Since Lorna is 5'5", we're going to try with the 60 centimeter ball. So first, we can actually lower the bottom part of the bed. Since the ball is bigger, we want to make room for her to be able to put her feet on top of the ball. Okay, can you please lift up your feet? Thank you. So for this position, Lorna is going to, perfect. She's going to put her feet on the peanut ball. Her knees are spread apart. Her ankles are together. And her toes are pointed outward. Just like in the ballet plie position. So to really help bring up that cervix, so the head can also press on the cervix as the baby's head tries to descend, we can bring the peanut ball up as well. Is this a comfortable position for you?
It is.
Oh, wow.
Yes.
Awesome. Well, there you go. This is a comfortable position. And again, we want to be mindful of her comfort. Do not raise the bottom of the bed up too high where it can cause tension. Because again, anything that can cause tension is not going to allow for fetal descension as easily and smoothly. Is that good? So we can bring it up higher. Thank you. We can also try fitting one more size ball and making sure that it fits well. I will try with the 50 centimeter ball. All right. So because we want her feet up, so the cervix, her baby's descent can really put pressure on that cervix. I'm going to bring the bottom of the foot up a little bit higher. Is this comfortable for you? It's okay? Which one was more comfortable? The 5'7". Okay. So for Lorna, so the 60 centimeter ball was a better fit for Lorna. So this is a clear example of how one ball does not necessarily fit all sizes. And sometimes this one patient can need more than one size depending on the position.